This video is going to be about diabetes type 1. It is also known as juvenile diabetes or insulin-dependent diabetes. This chronic condition is an autoimmune disease that prevents the pancreas from producing insulin. It is less common than type 2 diabetes, and high glucose levels is called hyperglycemia, and low glucose levels is called hypoglycemia. When and who discovered diabetes? Diabetes was discovered in 1899. It was discovered by Joseph Mering and Oskar Minkowski with an experiment on removing the pancreas from a dog, which then developed diabetes. Years later, Frederick Banting did the same experiment, however found a treatment for diabetes insulin. Diabetes mellitus comes from the Greek word diabetes, meaning to pass through, and the Latin word mellitus means honey or sweet. A fun fact is when a diabetic person urinates, their urine has a sweet taste because of the glucose in the urine. Body systems affected. It affects the cardiovascular system, and it damages the blood vessels and nerves that control the heart, which can lead to hypertension. And hypertension can lead to having cholesterol, which forms buildup of plaque within the arteries of the heart and poor circulation through the body. Serious complications can lead to heart attack, stroke, and arterial disease. This affects the digestive system. With diabetes, a person can develop gastroparesis when there is nerve damage caused by diabetes to the digestive system, and this causes vomit and nausea, bloating, and weight loss. Weight loss is caused by the body not getting glucose to the cells, which results to body using fat, muscle as energy. It can affect the nervous system, which leads to neuropathy, and that means nerve damage. The nervous system can affect the sexual function of the body. It can also affect the urinary system, which damages the kidneys, and it can cause blindness because it affects your vision. The cause of diabetes. Type 1 diabetes is an autoimmune disease that attacks the pancreas beta cells, which are responsible for the production of insulin. The body is not able to produce insulin, or it produces a little insulin. It can also be passed down by genes. However, it may not show or develop if the genes are present unless there's a trigger to a person's body into developing the diabetes. An A1C test can be done to check for the glucose levels within the past 2 to 3 months, and a urine test can be tested for autoantibodies in the urine. Here are some of the symptoms to look for: increased thirst and urination, increased hunger, unexplained weight loss, fatigue, and weakness. Here are more available tests, which is the fasting plasma glucose, the random plasma glucose test, and again the A1C test. This chart shows that the American Indians and the Alaskan Natives are at highest risk of being diagnosed with diabetes type 1. Some of the risk and environmental factors include genetics and age. Type 1 diabetes patients need a lifelong insulin therapy. These can include short-acting and rapid-acting insulin, intermediate-acting insulin, or long-acting insulin. And of course, you need to keep a healthy diet and exercise regularly and monitor your blood sugar levels. As mentioned before, the risks for the treatments are hyperglycemia and hypoglycemia, but there is no complications related to the medication itself. The treatment does tend to get pretty pricey. An insulin pump is around $4,000 to $7,000, and insurance will only cover up to 50%. Insulin ranges $300 and up. Dietary restrictions of diabetes. Okay, you want to limit refined carbohydrates, avoid trans fats and saturated fats, and you also want to check the glycemic index of foods. Some more diet tips. You should focus on complex carbohydrates and the macromolecules, and also having a nutrients dense diet and varied diet is also important, as well as enough physical activity. Type 1 diabetes cannot be prevented, however, it can be managed with the proper diet and keeping a healthy lifestyle with enough exercise. And this sums up the video. Thank you for watching.